Right. So we're going to go ahead and get started. As people join us, feel free to keep talking in the chat and sharing ideas. So I am Dr. Lisa Carell. I am a solutions consultant here at PSG. And prior to working here, I worked at the college level with an EMS program, as well as in the field as a paramedic, an FTO, and a training captain. So I'm here to present to you today on advanced learning tips. The objectives of today, some of the things we're going to talk about. So we're going to explore evidence-based teaching and learning strategies to increase learning and retention. We're also going to discuss ways to foster student engagement through active learning. I have some great ideas to provide you that you can implement right away in a wide variety of classrooms. So everything from the flipped model all the way to hybrid and traditional. And we're going to discuss some best practices for improving both time and study management. So to improve learning and retention, we have to understand how our brain actually receives, stores, and then retrieves information. The information processing model or theory is a really simplified explanation of how the brain processes information and learns new things. So we receive information through multiple sensory channels. It passes through multiple stages of memory. So it goes through many more stages than what we probably grew up hearing about working, short-term, long memory. There's actually several stages of memory. And as information passes through each one of these stages, our brain further processes and refines that information. And then it decides if it wants to keep it, what shelf it should put it on for storage so that you can retrieve it later. Some other things that are really important to know about how the brain learns and commits things to memory. There are multiple different things that affect our learning as it goes through these stages of memory. So one of the first things is transformation. So students actually gain a greater understanding of content and concepts when they can take them and then turn them into something creative or turn them into a project or a product. Rather than just that memorizing foundational knowledge, them actually doing something creative with it and learning to apply it is what helps them transform it to be useful to them later. Another thing that affects the way we learn and how we remember things is emotions. So strong emotions can actually shut down the conscious processing of information, and it inhibits cognitive functioning. So we all know that our body kicks into fight or flight when something scares us or we have an immediate physical threat. But our brain doesn't know the difference between that physical threat of a bear chasing us and the psychological threat of like extreme emotional distress. So while we want to stress our students, while we want to put them through scenarios and simulations in a controlled environment, we want to manage the stress and build it up over time rather than just all at one time. They're going to shut down and they're not going to learn or remember anything that we're teaching them. Another thing that affects the way we remember and learn is our environment. So environments of predictable, repeated stimuli lowers the brain's interest in the outside world. It'll promote daydreaming. So while you may have students that will sit there and doodle and that's engaging their motor skills and they're still paying attention, those students that are drifting off, staring out the window, falling asleep in class, the long 8-hour lectures, death by PowerPoint that probably most of us grew up on, it doesn't work for actually committing things to memory. And finally, the why. So, but why is such an important question for our students to explore. Information sticks when it's understandable and relevant. So it's really important that we incorporate that why. Past learning always affects new learning. So if students have a really negative experience with learning, whether that comes from maybe a learning disability or just a past experience in the classroom, that is going to affect how they learn today. In addition, experience matters. So we are constantly integrating what we know, what we've experienced in life with what you're telling us today as new knowledge to integrate that and then make it either more understandable or more relevant. It's important to use emotion in teaching. I know I just mentioned that emotion can inhibit cognitive processing, but when done right, emotion can actually increase the way we process and store information. So, using humor, narrative type storytelling, engaging your students with multiple senses, and then providing real world examples, but not like the horror stories where everyone just wants to stand and tell all their war stories. You have to actually make it relevant to what you're teaching and how they would apply that. That's going to make it memorable for your students. Always provide the why. Without purpose, without knowing how it's going to be used and applicable for them in the future, information is very quickly forgotten. So, my hot take on this, as instructors, we are always asking, how do we get our students engaged? How do we get them involved? They seem like they're bored, they don't ask questions. Well, our engagement matters too. So, if we're showing up tired, salty from being on the truck all night, burnt out from administration, et cetera, that's going to pass on to our students. So, it really matters the way we show up to teach our classes. Research shows that students who feel like their instructors are care about being present, are invested in their students' success, will learn more and thereby have better performance outcomes. So, learning styles. This was previously thought of as a very concrete kind of concept. Original theory suggested that if we identify our students' learning style and we adjust our teaching methods to that specific learning method, then our students are going to learn and retain more, and they're going to perform better on our assessments. But really, there's multiple different levels of learning and levels of intelligence. There's different types of intelligence. We've all heard visual versus auditory versus kinesthetic learning, right? So instead of thinking of this as a concrete singular concept, we need to think of it as a preference. So I prefer to be a visual learner. This word cloud of a brain is a great example of how my brain will pick out information and pull it up later. It's different colors, it's very engaging visually, but I also still learn auditory. I still learn through using my hands. So if we think of it as a multidimensional sensory process, and that each one of these stages of memory takes in information from all these different routes, then we can approach the way we teach our students differently. So while it's not a concrete theory, we don't want to just throw away this theory either, because it does have some value. So let's take our understanding of learning styles and shift it towards a learning preference. And let's keep a few things in mind. So not everyone learns the same way. It would be impossible for us as educators to adapt our instructional delivery to match every student in our cohorts. But what we can do is we can create experiences for our students that incorporate a variety of approaches. So retention and learning is a multisensory process. Each student is going to grasp something presented, whether it's leaning towards one learning preference or another. They're still pulling in all of this information and processing it in their own way. So it's really important that we recognize that and we present our material in a multisensory environment. We also need to remember there's multiple forms of intelligence. So on the truck, in the field, how many times have we said they're a great book learner? That student can take a test like no other. Or that student, they're terrible at written tests, but they do a great job at the hands-on scenarios. So that's a perfect example of recognizing that each of our students has a different type of intelligence. But just like learning preferences, they might have one type that's front and center. The others might need a little more exercise for them to strengthen. They still have a little bit of all of these types of intelligence that they can use to actually succeed in the classroom. At the core of it, despite being unique and having all of these differences in learning, we're so much more alike than we are different. We all actually do learn from multisensory input, and we all have multiple forms of intelligence that we can strengthen. Don't be afraid to change your instructional delivery based on your content. So the way I approach teaching paramedics drug math is completely different than the way I teach them drug administration. One might be very like I'm using the whiteboard and we're doing calculations and we're writing everything down. But when I'm teaching how to actually administer medications, I'm doing a much more hands-on approach, visual approach. So don't be afraid to change things up depending on what your lecture is about that day. So the majority of us in EMS and fire education teach adult learners. Teaching adult learners is a little different than teaching K through 12. So some things to note about teaching this population of students. They are a need to know type of student. They want to know relevance and the utility of new knowledge. They don't want to waste their time. Don't tell me a bunch of things that I'm never going to use in my career because I don't have time for that, right? They also tend to integrate their experience. So they're constantly taking their experiences, whether it's other classrooms, experience in the field, something they've seen or heard, and they're going to connect that with the new knowledge we're giving them in the classroom. And that's going to create a deeper understanding and almost like a different type of knowledge. It's going to be much more robust because of that experience. They want life-centered orientation. So they want practical problem solving, immediate applicability when it comes to what they're learning. They don't want busy work, doing something for nothing. It feels like a waste of time. Adult learners also tend to be really self-directed. We've probably all seen it in our classrooms where our older students or our experienced students, maybe they're coming back to the classroom after several years, they tend to be very self-motivated. They have a lot of autonomy. They like a sense of control. So offering them some choices, having some flexibility when you're making your scenario plans, et cetera, that can really help learners feel like they've got some autonomy in the classroom. They also come to us with a readiness to learn. Many times these students are there because they want to be there. They are intrinsically motivated. These 2 points kind of go hand in hand. So they're either there for their own personal development, professional development, career progression, but they have this desire to learn. And that relevance that they're seeking and hopefully find in your classroom will increase their engagement. So what does this mean for us as instructors? So some practical takeaways for adult learners and teaching in the classroom. We want to make the relevance of the content we're delivering explicit. They need to know exactly why this matters. So for instructors, we need to really explain the why and the how this process works or how you're going to use it in the future. For students, this looks like aligning what you're learning to your career goals, your real world goals. So if you're starting in the classroom and you're set out to be a paramedic, start aligning those things with, well, my goal is this. I'm learning respiratory today, and this is where it's gonna set me up for success in the future with my end goal. It makes it relevant. You want to build on prior experience. So as instructors, we can use case studies, we can use reflection, discussions, we can talk about interesting, unique things that we've seen in the field and really relate it to what we're delivering content-wise in the classroom. For students, this can look like peer sharing. In your study groups, if you saw something really interesting on clinicals or your preceptor showed you a trick for something, share that with your peers. Now they're going to have that story, that visual, and that's going to help them build that experience to tie to the content. You want to focus on internal motivation and support. So with this, we really want to emphasize not perfection, but we want to emphasize growth and mastery. This also supports the concept of autonomy in the classroom. So we're going to provide them with constructive, timely feedback. We know they're not going to be perfect the first time they write us a narrative after a scenario or a practical exam. But if we don't grade that and give them constructive feedback right away, they're going to come back and write the same report next time, and there's no growth there. So you want to make sure that you're really giving them touch points throughout the semester so that they're improving along the way. Provide clear structure with some flexibility. So we want to give them a very clear roadmap of this is what our course looks like. Here's our syllabus, here's our schedule. But flexibility can look like providing multiple ways to access the material. So maybe they have the actual textbook in their hand, but you also provide them with Navigate, and it has the ebook, the audiobook, the interactive lectures. So they have some autonomy in that, and they can choose which one speaks to their learning preference. We want to break our content into manageable chunks and then have frequent checkpoints. So even though we may build our paramedic cohort the same way every semester, we want to make sure that we're still breaking it up into chunks and checking in with our students frequently. That way, we're identifying misconceptions, misunderstandings, going back to that feedback before they get to the final exam, and then they're struggling. Finally, we want to promote active engagement, and that's what's coming up next. So in the chat, I would love to know what makes learning feel like it's worth your time. What is an example of something that made you feel like you wanted to invest even more time in your studies so that you could become better at it? I'd love to see you guys share some ideas with each other that can help you take these ideas back to your classrooms. So student engagement through active learning. What is active learning? Does it really make a difference? So active learning model, the students take ownership of their education, they participate, they have discussions, they learn to apply and integrate concepts. It's so much more than that, like I'm going to memorize some things and check off on it later. So they actually have to dig in and really develop an understanding of the why and the how. Active learning moves us from a teacher-centered environment of passive sitting, listening to my lecturer, or my professor drone on for 8 hours at a time, more into that doing, creating, and thinking. So if we go back to the first couple slides about memory, one thing that really helps us retain information and apply it later is being creative with it. So having activities, whether it's simulations, scenarios, projects that your students are actually digging in and creative with, that's going to solidify their retention of the material you're presenting. Research shows that active learning environments improve student perception of instruction and learning. It also improves student engagement because now they're having to get up and they're having to participate in the learning process. It also improves performance outcomes. There are several studies across multiple healthcare disciplines that show active learning actually increases exam scores and national testing scores. Some of the benefits of active learning. So it provides opportunities to process course material and multiple avenues for learning. Because again, we're providing our students a multi-sensory environment. It's not just me lecturing them for however many hours a day. It's not just the memorizing a skill sheet. We're going to give them things that are going to speak to all of those senses. It helps students transfer and encode information. So students aren't just sitting there passively listening and hoping they can recall it later. They're having to learn how to actually make it relevant, how to apply it, how to integrate it, all of the things they need to be successful in EMS and fire. It creates personal connections with the material. And the frequent and immediate feedback helps correct misconceptions and reinforce understanding your students. So because we're checking in with our students multiple times through these activities, we're able to identify things long before they bomb an exam or don't pass their national. So when I talk about active learning, instructors often think that I mean a flipped classroom only. I love the flipped classroom model. I know it works. I think it's an excellent model. I love using the flipped classroom model. But I also recognize that it's not practical for every program or department. So when I talk about active learning, I mean incorporating evidence-based best practices into your everyday traditional classrooms. So you might not be able to completely flip our classroom, but we might not want to. We might not be able to run a hybrid program, but it doesn't mean that we have to stick with the, well, we've always done it this way, rinse and repeat method, PowerPoints, and the talking head at the front of the classroom. So we can create an engaging and active environment that invites our students to participate, encourages critical thinking, problem solving, and then increases their learning and retention. So some strategies for creating this active learning environment in your classrooms. Think, pair, share. So think, pair, share is where you're going to give your class question. Everyone's going to get the same question. The students are going to think about it individually for a few minutes, maybe jot down a few notes, and then they're going to get into pairs. They're going to talk about it and share their insights with each other. And then after that, they're going to talk with the group and share their insights with the group. This is a great way for them to get different perspectives on material. I might explain something and they don't understand it, and then their classmate says the same thing I just said, but slightly different, and now they suddenly understand, right? So this is a great way to help them develop those peer groups and support each other. Another great active learning method is the jigsaw method. So with this one, you're going to divide students into groups, and those groups are going to become the subject matter experts. So an example would be respiratory disease processes. I have an example towards the end of the presentation on how you can do the jigsaw method and assign your groups a subtopic. So each group gets their own topic, they dig into it, and then they're going to present it and teach the other groups what they learned about it. How many of us learned so much more when we started teaching versus when we were just practicing in the field? The more we teach it and explain it, the better we understand material. So case studies are another great example of an active learning method. We probably all use these already and maybe we didn't realize it. But with case studies, we're able to analyze real life scenarios. This is going to bring that conceptual knowledge, the key terms, the things we're reading on a book, and it seems so abstract, to an actual problem solving application and give our students a mental image of what it's going to look like, how they would apply it in the field. And then another example is minute papers, as well as entry and exit tickets. So with minute papers or entry and exit tickets, students are going to summarize the main topic of what we discussed today. They're going to also add something in about how would they apply that. For us, it can also provide us another touch point where we can identify any confusion that our students might have. And then the next class, we can revisit it and clarify that knowledge for them. So some learning games and concepts to make learning sticky. You can use case studies, like I mentioned. Scenarios is another great one that will help bring knowledge to application. And your scenarios don't have to always be high fidelity simulations. It can be as simple as throwing a CPR mannequin on the floor and then having them walk through scene size up and safety. Start from step one and then just keep going through it. Escape rooms is another one that's making a lot of traction in the education world. And these could be simple to complex. I use one in my cardiovascular classroom where the rooms, so to speak, are just folders and they have several questions to answer. It gives them a scrambled up word. They have to unscramble that and then they get the next folder or room. So it's something to get them engaged. And then there's always like a little incentive at the end. But if you have the space, you can also create some really cool, complex escape rooms. And the internet is full of great ideas for that. Bingo, Jeopardy, Jenga, and Kahoot. These are also some of my favorites to use in the classroom. There are some great resources online for creating bingo cards and Jeopardy boards. With bingo, it's not the traditional beach, right? So what I do is the call number that I use would be, what is the vein that carries blood back to the heart? and the answer would be in the column. So they have to find the answer. So I'm actually making them dig in their brain for knowledge to answer a question and see who gets bingo. Jenga is another game that I've been using for years. I use the traditional wooden Jengas, and each little wooden block, I write a concept, a patient presentation, a chief complaint, a medication, whatever, and I stack it up. And then whichever one the student pulls, before they can stack it on top of the pile, they have to teach their classmates that concept. So that's great for reviewing things. And it's great for firefighters that are really competitive. Those were my favorite ones in the classroom. They really get into Jenga. Concept and case mapping is another one of my favorites. As I mentioned earlier, I'm very visual, so I love a great case map or concept map. I do have a few examples here in a couple slides to show you. And then, like I mentioned, those entry and exit tickets, an opportunity for your students to reflect on what they've learned. So active learning from the student's view. So active learning does increase their cognitive load. So initially, students are going to feel like it's harder. However, once they get used to it, it's different than what they've known. But once they get used to it, the result is they're actually going to learn this material. They're going to retain it. They're going to have better performance outcomes, and they're going to see where it's worth the extra effort that they have to put in. They also have to leave their comfort zones. So we all have the classrooms where students the first few weeks don't talk to each other. They just kind of sit on their own. This active learning requires that they interact with each other. And it shifts again from what we're used to that interactive, collaborative, teamwork approach, which is another great thing to teach them going into a field where we all have to function as a team. So better retention comes from active learning. Students will see that they have a deeper understanding of the material. They're able to not just recall it and give you a key term, but they're actually able to explain it to you. And it's going to increase their ownership. So now they feel more invested in the material. They can connect it to their experiences because they're actually doing the work of owning their learning. So some time management strategies for cognitive efficiency. So the first one is work with your brain's peak times. If you're not a morning person, don't do the hardest task or the most complicated task that you struggle with first thing in the morning. I'm not doing math first thing in the morning. So you want to work with when your brain can really latch onto those concepts. Time blocking. So time blocking is a dedicated, specific, uninterrupted time chunk that you're going to set aside for, I'm going to study for this hour, or I'm going to review skills for this hour. So having that set aside with no interruptions will really help you focus on what you're doing. Rest, sleep, and non-sleep. So we all know we need good sleep, but REM sleep, that REM cycle is actually tied to memory transfer. So all throughout the day, we're getting all of this sensory input. How do we actually get it to long-term memory where we can use it? We need good sleep. We also need rest in a non-sleep capacity, meaning sometimes we just need to log off, walk away, no notifications, no doom scrolling on the couch all weekend. We just need to shut our brain down from cognitive processing for a little bit and give ourselves a rest. The Pomodoro technique pairs really well with time blocking. So Pomodoro is breaking larger blocks of work, so your time block, into specific work and rest time segments. So you can use a timer on your phone, or I have a little one on my desk, and you can set it for 35 minutes of work time, and then I get a 5-minute break time. And that really helps me focus on what I'm doing for the moment. Now I get a break coming up. Don't task switch. So this is one of the ones that kind of surprised me because I always considered myself to be a great multitasker. But multitasking from a cognitive perspective is actually a myth. The more we try to multitask or switch between tasks fairly rapidly, the less cognitive load we can handle. Because every time we start back on that other task we were doing, it's our brain takes a minute to fire back up. So when you've set your time block and you're actually going to focus on something, really focus on that. Don't switch back and forth. Prioritize your workflow. So a couple of questions to ask yourself when it comes to workflow. What drains my learning energy? Like, what would just ruin the rest of my day? I know this is going to take a lot of effort. If you know that's going to take a lot of effort, you want to make sure that you're working with your brain's peak times, and you want to prioritize that. What produces the most learning return? So if sitting here and writing out answers to questions or rereading the same paragraph is not actually helping you remember anything, you're not getting much return. You're just staying busy. The same thing applies as instructors. We're just giving our students work to keep them busy, but they're not actually learning from it. It's not producing something. Busy does not equal engagement. They're just on autopilot. So those are two really good questions to consider when you're building your classroom or when you're a student yourself. So some high impact study strategies and some things that don't work very well. So instead of passively rereading and highlighting the same paragraph over and over, you want to practice something called active recall and application. This looks like self-testing, or after you've studied something during your time block, shut your book, write everything you know on a piece of paper, but then dig deeper. The application comes from, I recall all of these things on this piece of paper. How would I apply it in this scenario or that one? Not connecting material with real world problems or experiences. Instead of doing that, you want to do problem-centered practice. This goes back to looking at case studies or seeing how this would actually integrate into what we want to do in the field. So making it relevant will make it stick. Instead of relying heavily on just summaries or notes, you want to teach it. So we go back to that slide about when we teach it, we know it, having our students become the subject matter experts and then teach something. That's because when we try to explain something, we know we have to really understand it to explain it to someone else. So instead of just looking at the surface level of summaries and notes, dig deeper and then learn how to teach it to someone. Studying in long, unstructured blocks. That will just make you hit the snooze button. So instead of doing that, you want to practice something called interleaving. Interleaving is mixing multiple related topics in a single study session. So this is not task switching. We're not going to go from I'm studying, math to I'm studying science. We need to have related subjects. So I'm studying the respiratory system. And now in that study session, I can look at pathologies. I can look at anatomy. So I'm going to kind of break my block up into different components of that one main topic. Instead of only reviewing what you already know, you want to practice something called deliberate practice. So deliberate practice is highly structured, goal-oriented, and what you're going to want to do is create a very highly defined goal or focus, and then break that one large focus into smaller tasks. So going back to interleaving, I'm going to set my goal is I need to understand respiratory system pathophysiology. And then I'm going to break that up into very specific steps so that I can meet that goal. Instead of staying on the surface and then not actually digging into the why and the how, you want to do self-testing and elaboration. This kind of pairs really well. It's almost like the advanced version of the active recall and application. Now we're going to go a little bit farther. So we're going to practice retrieving answers, which can come from practice quizzes, flashcards, whatever we want to use for that review. But then we want to dig even deeper. So maybe if I'm looking at the key term or subject of what is shock, and I can define that as hypoperfusion, but now I want to know, okay, well, how does shock work? Well, how does each type of shock work? How is each type different? What makes them different? What makes them similar? Now I'm really digging into how and the why, and that's going to help me retain that information better. And then instead of doing marathon cram sessions, just, the pulling an all-nighter, remember, busy does not mean engagement. We want to do something called spaced repetition. So with this, we're going to actually proactively schedule out our study sessions. So look at your calendar and when your exams, like your high stakes exams are, and set up time blocks on your calendar with very clearly defined goals for each block. And that's how you are going to increase your cognitive efficiency and then learn more. As you're like forcing your brain during spaced repetition to recall things as they're starting to fade from your memory will actually permanently strengthen your memory. So it's a great brain exercise too. So I have a few examples of activities that you can use in your classroom to foster critical thinking, problem solving, and retention. So this is an example of an exit ticket. It will reflect on one key point that they learned during today's, and they're going to write that down, and then they're going to write down a concept. How would I apply this concept? And then I leave a space for students to tell me if they have questions. Students might be embarrassed to ask a question or say they don't understand something in class. So by having them write this on there, the next class I can come in and I can just address it generally, like, hey, let's reinforce XYZ concept. And then I can clear all of that up with my students. It's a great way to have consistent touch points with your students. Case mapping. So this is an example, very typical PowerPoint slide. It has the risk factors, complications, all the things that go along with the physiology of breathing. Not very visual, doesn't always connect the dots, but it's the very traditional way of teaching, right? So instead of just presenting it this way, provide your students with a case map. So in this case map, I'm going to ask my students for the most common risk factors, diagnostics, treatments, etc. What it looks like is this. So I've given them a brief scenario at the top with just bare minimum information. And I want to know, what are the most common risk factors with how this patient is presenting? What things should they anticipate? All the way down to the next steps to consider. That part is helping my students integrate everything they're learning after they're applying it and start thinking ahead. That critical thinking that comes with being 5, 6 steps ahead of that patient. So this is a great one to kind of tie all of that in together. Concept mapping. So concept mapping, you can do this a variety of ways. So you can create a PowerPoint and you can have the shapes or circles with different colors for different, you can color code it and have that on a PowerPoint and then fill it out as you go. Your students can copy it down. You can draw, this is one of my favorite ways, draw the beginning shape on the whiteboard and have the students take turns creating branches. My students are pretty familiar with this. If they walk in the classroom and there's a circle on the board and it says chest pain, they typically know what we're about to do. You can also provide them with a blank concept map and fill it in while we're discussing it. So an example of one of my concept maps is this one. So I would start for this one with the chief complaint of shortness of breath. This one was a way that I got students to work on differential diagnosis. So I wanted to know what are some of the conditions that cause a patient to be short of breath. And then the little circles was, so how do they present? What makes them different? What are the signs and symptoms, et cetera? You can really build these out whatever way would work best for your student. Another example of a concept map, and this one goes back to the jigsaw method. So if you have groups of students that you want to be your subject matter experts, this is an example of a worksheet I created where it would be blank on the right side where you see all of the patient presentation, and they would just have groups. So each group gets assigned one of these conditions, and then they have to fill out that right side and then present it to the class and teach each other about these conditions. Get creative with your students. You can also have your students get creative and do things that are outside the box. So you could have your students make a video that demonstrates the cardiac conduction system. If you go on YouTube, there's tons of videos where people demonstrate cardiac arrhythmias, one's the atria, one's the ventricles, and they look all silly. Um, a video demonstration of medication administration. I have an example of that on the next slide. That's another great way. Have your students create a video of how they would administer a certain medication. Tell them they need to be creative with it. You can create a set of lungs from 2-liter bottles, other easily accessible supplies, or assign that to your students and have them bring their models in. Then they have to teach their classmates how it actually works in the body. I have a video of how to give adenosine.
Okay, so one of the ways to use a three-way stopcock on giving adenosine is to hook up your adenosine, which is this red, we're going to use red food coloring, and your saline flush, because adenosine 6 milligrams is only 2 milliliters. So if you have your saline, even if this is prepped with saline, and you push this, you can see where it doesn't really get all the way into your patient. So this isn't the rapid push, the saline is. So if you push this into your patient, you have to hold pressure here. If not, with the pressure, this will back up. So hold pressure and then flush this into your patient, and then you've given a rapid adenosine push.
Now I would love any questions that you guys might have for me. If you want to drop them in the Q&A, then we can easily get those questions and start answering those for you. Scroll through the chat, see if I can find any questions. Hi, Michael. Yes, since you're registered for the webinar, you get a link to the recording of the presentation, and so you'll be able to see the beginning of it. Yes, send out copies of that, and we can make a copy of the actual presentation. And I'm happy to share any of the resources that I've created as far as concept maps or anything. I'm happy to share that out as well. Does anyone have any questions? How do you engage students who may not be interested in a topic? That's a great question, Margaret. So I think in a lot of cases, our students typically want to be in our classrooms, at least in this realm of education, EMS and fire. But some of the topics are kind of dry or boring or really hard. And so that's where I think creating these activities to where it's not just I'm up at the front doing a PowerPoint presentation for my students really helps them. An example would be in my cardiovascular class, learning heart blocks is really challenging. And that's where I see a lot of frustration can show, and they tend to disengage. And so that's when I really bring in a lot of like activities and things. We do a lot of bingo, Jeopardy, things where they're still learning those difficult topics, but they don't, I almost feel like I'm tricking them because I'm like, hey, let's play a game. And then by the end of it, they're like, oh, wow, now I know what third-degree heart block is. So sometimes just getting them up and getting them invested in doing something with what you're trying to teach them will really help increase their engagement. Although some students may not see the relevance in the material, don't you have to present it in order for them to better understand what they need cognitively to take their exam? Not suggesting we teach the exam. Okay, so Jeff, if I understand you're saying that even though students don't see the relevant material, we still have to give it to them. And yes, we do. But that's where as instructors, we can think outside the box and find ways to make it relevant for them. So even when it comes to the basic foundation knowledge, going back to my experience in the EMS classroom, when you tie that to outcomes with your patients, like a lot of paramedic students can't wait to start an IV, right? They can't wait to do ALS stuff. But when I'm teaching them BLS before ALS or something like that, tying that to an outcome, for example, telling my students this one time I had a terrible intubation and I couldn't get it to save my life, but I maintained his airway for 16 minutes using BLS, it makes it relevant, right? So I think that's where, as instructors, it's on us to find a way to make it relevant to where it clicks with them. Are we going to reach every student? No, but we can certainly. Earl asks, any particular topics or concepts for increasing engagement ESOL adult learners? That is a tough one. That's a tough one. I don't have a lot of experience in the ESOL adult learners. I do know that finding multiple sensory inputs for teaching that material can help. So if it's a language, if they're struggling when it just comes to reading the textbook, letting them, having that navigate classroom where they have access to an audiobook will help a lot, because now they can listen to it. They can also pull up their ebook and they can listen to the ebook while it highlights the words. So then they're able to associate the written word with what someone is saying to them. Doing a lot of hands-on, the activities when it comes to actually putting things into practice, those students are probably going to be a lot more engaged and remember things when they can actually see how it works, like in the lab, doing scenarios. I think that would help them connect the dots. I hope that answers your question. Dr. Jones Cheney, no, we do not currently do certificates from our webinars. They're not associated with like CEUs or anything like that. Did I miss anyone's question? What do you do when a student or group works on a mapping and then they present? So that's where, as an instructor, I usually will walk around, like I'm doing constant check-ins while they're working on it to make sure that they're not teaching each other wrong, because that certainly can be a risk. But if you're going around and kind of checking it as they go before they present, but also it's a great opportunity to clarify things. I've done concept maps where the student will present something and it's off or slightly wrong or whatever. And that's where you can go, okay, hold on, let's dig into that a little bit deeper. And then you, as the true subject matter expert, are going to offer your expertise. Because when it comes to concept mapping and group work, this is not something that they're going to be presenting to their class without you present. This is something that you're very much involved in. Any other questions? I love all these. These are great questions. Do you recommend private personal laptops versus provided computers? So Joshua, I think that kind of depends on your students. I know a lot of students might have challenges having their own laptop. The EMS program that I worked in, we initially students weren't allowed to use their own computers. I think recently that's changed. So I really think it depends on what your students have available to them. If they have a personal laptop, I certainly recommend that. I know a lot of my students use iPads. I provide all of my PowerPoints and my handouts, like my concept maps. I provide all of that to them ahead of time. And my students come to class with it loaded and they use their iPads and like GoodNote or whatever app they're using to take notes directly on the materials I've provided them. What results have you had in competitive gaming? So with that one, I will say I have seen, since I introduced a lot of gaming, whether it's the escape games, Jeopardy, Jenga, I've had great success with it because I've ended up with some really super competitive classes that actually surprised me. It's silly, but I have a treasure box. I teach college, but I have a little treasure box that I bring with me. My students love it. And so I'll bring my treasure box. They know we're going to play a game and they want to know, has Dr. Carell updated the treasure box? What am I going to get out of it today? And they get highly competitive. Through that competition, I can tell they're studying more, they're digging into the material more because they know at some point we're going to play a game with this and they want to win. So across the board, and when I started using Jenga, for example, I was a captain at the fire department. And so I was teaching firefighters and EMS who I was teaching primarily paramedic. And even some of them that weren't super excited about becoming a paramedic actually got excited in playing these games and making it really interactive. And then I saw that again, they were learning the protocols, the medications, because they also didn't want to look stupid in front of their classmates, by, pulling an answer and then not knowing it. Hi, Bruce. Yes, if you, I think the easiest way, if you want a copy of my concept maps or my diagrams or anything, I think the easiest way is if you contact your account manager, they can forward me your email and I'm happy to send out. I have lots of educational handouts. Again, I'm super visual. So I'm happy to share whatever resources I have created over the years with whoever would like them. Yes, sir. Any other questions? Awesome. Thank you guys so much for coming and being a part of our webinar. We do have another webinar coming up in 2 weeks, how to use Navigate 101. We would love to see you there. And if you have any questions, feel free to reach out to your account manager and they will put you in touch with us. Thank you.